This is Lisa and Rue. I'm Lisa, and this is Rue. I'm a professional dog trainer, certified canine nutritionist, and founder of Zumi's Dog Training and Adventures, as well as our new brand, Zumi's Dog Nutrition. This podcast dives into the whole dog. We talk training, psychology, nutrition, and so much more. Our goal is to help you explore new approaches to thriving with humans' best friends. So today I'm very excited to welcome someone super special, Dr. Lucy Scott from Veterinary Behaviour Services New Zealand. She's a lot of things. She's a qualified veterinarian with a membership in veterinary behavior. She works with dogs, cats, horses, and blends medical science, emotional well-being, and compassionate training to help animals who are struggling feel safe again. She's worked with hundreds of animals and become a really powerful advocate for understanding what our pets are feeling before we jump into labels or assumptions. And her mission is to help animals and their humans through the big stuff while strengthening their precious bond along the way. So today we'll focus on dogs specifically, even though she works with cats and horses and these things as well. And we'll explore the connection between body and behavior, which is a really important conversation and something I'm very interested in, so I'm really excited. So let's dive in. Welcome, Dr. Lucy.
Thank you so much for having me. I'm really looking forward to having this conversation this morning. Yeah.
So let's get straight into it. I know you're busy and studying, so I know you've got just a little bit of time. Hopefully you have a bit of Christmas break coming up as well. I know it's my last week, so yeah. um, can you just start by sharing a little bit about your background and what led you into veterinary behavioral medicine?
So I finished at Massey with my veterinary degree and went and did pure sort of mixed practice in rural Waikato. And while I was there, and I was finally able to have my own horse and dogs and cat and all the rest of that, I went to a horse clinic actually, which was clicker training, positive reinforcement training. And I remember having this conversation with another vet and an animal behaviorist, and standing around the kitchen table going, "Yeah, we don't do a lot of behavior at vet school." And that sort of ignited something in me. And then I was working full time and doing after hours and sort of just doing a lot of just being a vet, really. And then I went
Yeah.
to this teens evening where we were talking, where the Bex Tasker from Positively Together had put together, where she was showing her group of teens and young people about what sort of jobs there were in the animal industry. And I was there to be the vet. And I remember sitting next to a dog behaviorist and a horse trainer who was also working in the industry as well. And the three of us were just talking about things, and it came up, and I'd looked at the qualification that I wanted to do, and that everybody just jumped on and was like, "You have to do this. We have such a need for veterinary behaviors." And it sort of lit a fire under me to sort of look into it a bit deeper. And it didn't happen until I got a concussion and laid me on my butt, and I realized that I didn't really do full-time work as a vet before. But I needed that sort of moment of, when it was a lot of COVID was a little bit like this for a lot of people. It was that
Yeah,
moment where you stop,
absolutely.
you pause, and you realize that you've been rushing down this path, and actually there are other paths, and maybe I should go do this qualification and start up my own business, because there weren't anybody else really doing it in my
No,
area.
yeah,
So
yeah.
yeah, that's what I did. That's how
It
I
seems
came to do.
very rare in New Zealand compared to other countries, would you say, to find
Yeah,
a
we've got, I think, don't quote me on this, I think 10 of us who've done
mm,
the veterinary behaviour membership exams now, which
mhm,
is through what we call the Australian and New Zealand College of Veterinary Scientists. And we
mhm.
don't have a specialist. So watch this space as more of us get into it, and hopefully we'll be able to, train up a resident to be a specialist as well. And that we
Yeah,
have it in New
yeah,
Zealand. There's only
yeah.
4 specialists in Australia, so
Wow, yeah, so
we need our work.
needed. So I suppose that was sort of your pivotal moment, which was my next question. It seems to be when you were at this event and, you were with other people in the industry and then you got a concussion. Yeah. Yeah, the concussion was the pivotal moment. Awesome. How would you explain what a veterinary behaviorist does to the everyday dog owner who may not realize that the specialty exists?
So I would say that I sort of look at things holistically so that I can sort of look at things from a medical point of view, and I can look at things from a behavior point of view and learning and stress. And a lot of my cases are really complicated, and people
Mhm.
often think that one behavior, a behavior is one thing, and often there are a lot of contributing factors involved. So I help untangle it a little bit and help them understand why their animal is doing it and how we can help them and we can help the human, of course, because we really want to preserve this sort of animal human bond, which is the
Yeah.
heart of it all.
Yeah, yeah, awesome. That's beautifully said and definitely so needed. So, when we talk about dogs whose behavior has a medical component, what does that mean?
So first off, I like to think of things as problem behaviors. So behaviors that dogs do naturally that are a problem for humans. So
Mhm.
digging dachshund is really innate for them to do that. And then you have things that are a little bit more complicated and they're also a problem for the animal. So that's behavior problems. So sometimes in those cases, something is contributing to it. So whether that is underlying pain or a hormonal issue or a
Mhm.
there's lots of ways that medical conditions can affect behavior. They sort of say, oh, you can increase behavior or decrease behavior. But what does that look like and what behaviors? Uh, and they could, medical conditions could help in the development of behavior and be gone, or they could be still there and helping maintain the behavior, or they can affect the intensity of our issues or affect random behaviors and symptoms. And that's something that affects overall stress as well.
Mhm.
And then you also got like how it affects learning and memory formation as
Yeah,
well.
yeah, yeah. You can go down a rabbit hole with any particular thing. It's so interesting. What are some of the most common issues that would like present themselves as reactive or anxious or naughty? Is there a common denominator or is it really more complicated than that?
Common health issues I've got everything from the dog that was toileting in the house because he had
Mhm.
a underlying hormonal issue, which meant that he really couldn't hold on to the toilet,
Mhm.
through to dogs that are barking and lunging at other dogs because they are really fearful of those other dogs because underlying that they're painful and playing has been painful in the past.
Mhm.
One,
Mhm.
um, I kind of, there's not sort of like, and I'd say very commonly I get a lot of orthopedic issues, but I've also
Yeah.
had dental pain. We've had
Yeah.
skin issues. Skin can be painful, but also just like imagine being itchy all the time and how that would affect your
Mhm.
mental state.
Yeah.
Pain affects your overall mood, so your overall ability to cope with other stresses. So while there's sort of common things, everybody's an individual. So I might say, okay, well, a lot of my reactive dogs are often painful orthopedically, but that doesn't mean that this one is. It's
Mhm.
sort of, I don't know,
And
there's a lot.
specifically, like, when you're going into, like, a new case and you have a dog who's reacting to other dogs, and like you said, sometimes it was painful to play in the past, would you that be the first thing that you look at? Or, I mean, I know you probably have a really comprehensive chat with the owners and also observe the behavior of the dogs, but would that be sort of something that you would want to look at first? Or, like, what if I mean, obviously, there's also the side of the training side where you might need to do behavior modification, and would you do that first? And, like, which one would you say comes first? And, I mean, it's probably very case to case, but what would a red flag be for someone who maybe tried behavior modification and not that it's not working, but it's slow, or there might be something else where they think that there's something else. What would
Maybe sort of walk us through like a little bit of how I approach a case then, because I think that's
Mhm.
going to answer some of that.
Yeah.
So when I get a case comes up to me, I go through all of the animal's medical history and I put it in a little timeline. And then I
Mhm.
also send through a questionnaire. So as I'm reading through a questionnaire, sometimes there'll be like little red flags that pop up to me. Things like noise sensitivity is really
Mhm.
well correlated with pain. There would be things like how it develops as well. So genetics is often a component, but also like early learning, early socialization, and
Mhm.
like even down to mum stress during pregnancy. There's all of these little factors and elements that build up to how that animal produce. It's like that. There's
Yeah, yeah.
all this sort of like all these little parts of the recipe that create an animal's personality and temperament, and those are parts of it too. And then you've got, learning history as you go and experiences. So I always say, trauma is a subjective experience, and so is pain.
Mhm. Mhm.
I'll have people who go, "Oh, well, he's never had any problems with other dogs," but well, that's not necessarily true. Like, if we ask him, there might be some traumatic experiences in there that could contribute to it as well. I'll sort of usually introduce, because I do most of my cases these days, I start with a telehealth consult. One, because
Yeah.
means I can get one on one with the person, I can get a little bit more engagement. They're not worrying about the dog that's trying to eat me in
Yeah.
the background. Or and then I can sort of introduce the idea, because a lot of the time people are like, no, 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 there's nothing involved. I'm like,
Yeah, yeah,
one of
yeah.
my cases has something underlying, just contributing there. Sometimes then I'll get them to send me videos, and I'll get them to, or when I go and see them, I will go, just seeing that this animal is just moving in a particular way. Or have you noticed that he has, scratched 10 times in the last 5 minutes?
Mhm.
Sometimes the owners kind of, because they're living with them, and they're not, they don't sort of, they're not trying to detect those sorts of signals.
Mhm.
That's itching. I mean, sometimes they become so desensitized to them. That example, a case where the
Yeah.
dog was literally like itching in front of me instead of this chicken right here. Like, he's not
Yeah.
trying to, he's so itchy. He's more interested in scratching than eating the chicken. But they were so desensitized to it, they hadn't seen it before. So sometimes there's a little bit sort of eking it out as you go and seeing signals as in either, because a lot of the stuff is via telehealth and videos or in person. That,
Mhm.
yeah, I mean, it's people sort of go, pain, pain is not the only thing involved in anything. Yeah, yes, like pain will increase the intensity, or it will help, it will drive memory formation, or it
Mhm.
will create a traumatic experience, or it will affect the intensity of, I said intensity twice, I think, but there's a
Yeah.
lot of times that,
An important
or
word.
drivers that an animal, especially young animals, I get a lot of times that they're young and athletic and they're keen to do things, but then you get like over intense behaviors, and that's one of the things we're looking at for
Mhm.
red flags of pain. I've
Okay.
gone off on
Yeah.
a tangent, but
Yeah.
not because it's all the same.
Yeah. Yeah. So interesting. And I guess to relate it back to people, like, there's so many people with chronic pain, and they probably, I mean, I don't have chronic pain, but, they probably find things more difficult, and I mean, they do. And it's the same for animals. Yeah, really interesting. Why do you think that these medical behavior overlaps can be really misunderstood by owners? I guess you've sort of just answered that in the way that, sometimes they're living with the the animal and they don't see them, but how do you kind of open them up to that?
Sometimes it's a little bit about shifting their perceptions as well. I think there is a lot of times that people are told that their dog's just being naughty, or
Mhm.
the dominant word, or
Yeah.
they're just doing it because they, I don't know, they don't sort of understand. the underlying motivations behind the behaviors as well. And there's sort of so many varieties of responses to threats as well. So some dogs, we've got each dog will respond differently. So, your flight, fight, freeze, and fawn. I've got dogs that will
Yeah.
bolt and, bolt
Yeah.
if they hear a noise, and then others will alarm bark and use a fight response. And so a lot of the times it's really confusing to owners why they're doing the behavior. And then if they understand a little bit about why, then they kind of get a little bit of an understanding. But then you've also got the why is it so intense in your animal's case as well?
Hmm.
Why is it developed to the level that it has? And that can be one of the ways that you sort of go, this is not a normal amount of alarm barking. Right? This
Yeah.
is
Yeah.
this is this dog is not comfortable with normal amounts of stresses in its life. So
Yeah.
that's a
Yeah.
conversation we then have.
Yeah. Yeah. That makes sense. And would you, I mean, I guess it could also go the other way where someone thinks that there's definitely something wrong with their dog, right? And really it's just something small or, yeah. Do you
Or
get that
something
a lot as
normal.
well?
I
Yeah.
think in my cases, a lot of the time I'm seeing the quite intense cases, but I definitely do get times that I'm like, okay, this is a normal behavior for the breed of dog that you have right
Yeah.
now.
Yeah.
And then you're like,
Yeah.
I understand that it's a problem, but how do we make it his super, what's it called? His superhero. Is his it's actually, if we can use
Yeah,
this
yeah, yeah, a
behavior that
superhero
yeah,
for him. Yeah, yeah, use
yeah.
it for his advantage. Yeah, yeah, yeah,
So I do
yeah,
get that.
absolutely.
Yeah. I mean, and there's times that I've had cases that, the house, the property owner's killed a chicken, right? And
Mm,
you're like,
yeah.
okay, well that's actually unfortunately a behavior
No,
that is
yeah,
how,
yeah,
how but then it's like, and we understand, how do we prevent it from being practiced, and how do we
yeah.
use it
Manage the
in a way
situation.
that is suitable for this dog's
Yeah,
and still have
yeah,
his needs met.
yeah, yeah, yeah. Understanding normal dog and behavior, dog behavior and the behavior of the breed, I guess, is sometimes hard when we humanize them so much, which, yeah, I see that a lot as well.
And I got asked once whether or not I use sort of anthropomorphic terms, which means like relating to humans, or wolf centric terms where we're relating them to wolves. And I'm like, well, neither. They're not humans and they're not wolves.
Yeah.
They came from
Yeah.
a similar ancestor, but they don't have the same behavior, and they don't have the same hierarchical system. And so sometimes it can be it depends on the client. Sometimes I'm going to use a anthropomorphic, like,
Yes.
imagine he's a 2-year-old child sat in a cafe. Would it be okay if I came up and stroked his hair? Probably not,
Yeah.
and other times it's, yeah, you have to use a little bit more sort of,
The
yeah.
hierarchy. Yeah, just relating to the client and what they'll understand. That's really interesting actually, that question, because that's a lot of the times the two ways that people see dogs. So, yeah, that really sums up how we were brought up, I guess, to understand dogs, which is really interesting. In your experience, what behaviors most often signal a dog that might be in pain or struggling internally?
So noise sensitivity is a really common one that I
Yes.
see with
Yeah.
underlying pain. So is aggression.
Mhm.
Bites are
Mhm.
one. Yes, they can be related to high intensity fear,
Mhm.
but again, also there's this intensity of behavior that occurs with underlying pain, which increases these responses.
Mhm.
The barking and lunging dogs, the really frustrated dogs. We've got dogs that are bark and lunge because they're really, really excited. And then we've got dogs that bark and lunge because they're absolutely bricking themselves. And
Yeah.
those ones are often ones that I'm wondering about it as well.
Yeah. Yeah. And if someone had, I'm just thinking of clients, like if they had a barking and lunging dog, what would like your first it was pain, like, would you do a full body check, or would you go straight to, um, getting an X-ray done or something? Do you do bloods first? Yeah, I'm just thinking about what some of my clients might wonder when they hear this.
Bloods are always a good start because they give
Mhm.
us whether there's anything very big changes
Yeah,
or
yeah,
means that we're okay if we start meds, right? So
yeah.
it's sort of like a little screening. Are we okay to get started?
Mhm,
If I've got and I could identify a place or somewhere that I'm concerned about, then X-rays will be one of those steps.
mhm.
X-rays are like they're really quite an interesting one because people expect them to be really sensitive. Like, if we see something on X-ray, that. But if we don't see anything on X-ray, there's no pain.
There's nothing.
That's
Yeah,
not
yeah.
true, unfortunately. And so we have to kind of use our deductive skills and ask the dog.
Mhm.
But they're very, very good at hiding it, right? They
Yeah,
are a
very
prey
tolerant.
species. They're very prey species as well as a predator species, right? So they don't
Mhm.
want to show us where they're sore. So sometimes it's a little bit, we've got to gather evidence. Lucky enough, in some of my cases, I've heard that my duck cases go and have CT scans. It's amazing. That's really good. I've got
Yeah,
more information now, right?
yeah.
But because each one is a case in itself, and sometimes it's actually response to pain relief. So I'm telling vets all the time now, 10 days of pain relief, not actually long enough for us to be able to see changes in behavior. So because we've got two sort of, it's a little bit hard to tease them out, but acute pain and chronic pain. Acute pain, you touch the stove and you're acutely painful. Whereas chronic pain it's a really tough one because it's underlying and it can build slowly and it can just rumble around in the background and they're very good at hiding
Mhm,
it.
mhm.
So there's a couple of different definitions of chronic pain. One is pain that continues for more than 3 months. Let's say if it's 3 months today and 3 months and 3 days is 3 months and 1 day tomorrow, does that mean that it's chronic pain then? I don't know. There's also this maladaptive pain, right? So the acute pain it's important to keep you alive, right? It's a survival thing. But maladaptive pain is actually damage, like it damages has long-term damage on your emotional state and mood, and it stops you moving and that makes it worse. So
Mhm,
maladaptive pain is one of the things that can really slow down not only the animals but also your behavior modification plan and your ability to learn and your ability to just feel positive about life. I think we've gone off on a tangent, but
love it. Love this tangent. Yeah, yeah. So when you said that you often recommend longer for pain relief in dogs, and how long are you recommending?
oh, I still don't really know. So I'm recommending 4 to 6 weeks.
Mhm,
I've spoken to specialists in the UK who are going 12 weeks when they're working through a
mhm,
trial.
mhm.
Some vets will say just one medication. Other times we're going, I want to do a multimodal, so more than one type of pain relief.
Yeah.
And that's case dependent. If I've got a case that it's really, really, really struggling, I might use an anxiolytic medication, a pain relief, and what we call a gabapentinoid, which is one of those that does
Yeah.
both, because I really
Yeah.
need it to be back into a good state of mind before
Mhm,
I do anything with them.
mhm. Yeah. Yeah. Do you I'm going off on a tangent now too, but I know, like, in the States, for example, there's a lot of medicated dogs for behavioral reasons, but do you find in New Zealand, like, that we're still coming around to the idea?
I think we don't have a lot of understanding of it. And I
Mhm,
think that there's this misunderstanding that it should do everything, right? So I don't
mhm,
don't prescribe medications unless we've got the management and the behavior modification plan,
mhm.
right? Because those are
Yeah.
so
Yeah.
much more important. But then in other
Mhm,
cases, I do have cases that really need that support, right? And
mhm.
I'll find that owners won't get any improvement until we've got the right medications on board.
Mhm.
But I do think there's like a little bit of like, oh, you're drugging your dog. No,
Yeah.
we are medicating a diagnosed anxiety disorder so that their quality of life is at a level that they can then start enjoying things.
Yeah.
And if it causes lethargy and if your dog looks like a zombie, it's the wrong medication, it's the wrong type of thing for them.
Yeah. Yeah.
So there's
Yeah.
quite a lot of
Makes a big difference in some cases. Yeah, if they're medicated the right way, like, it's just amazing what it can do to help with their behavior modification plan or their life in general. Yeah, yeah. So hormones, let's go on to hormones because it's a really interesting one, and I think a lot of clients that I've discussed this with do get confused about it, and I would love to know more about it as well. So, in entire dogs who are sort of in their adolescent years, what's actually going on during that period?
it's complicated, which is good. I really struggle with there's a lot of pros and cons about when to de-sex,
Mhm.
whether to do so, and there's a lot of contradictory research even.
Yeah.
So generally in my adolescence, I try to explain that animals are these dogs are essentially their frontal lobe is not as developed as their reaction areas of the brain. Bit like a boy before he turns 21. They're risk takers. They're dopamine seekers. They
Yeah.
are in that sort of like, what's in it for me type stage of things. Like, are you going to pay me for this? Because I need that level of
Mm.
motivation. So I try to sort of explain that during adolescence, that's what we're dealing with. Even if we don't have, even if they were de-sexed early, right? And then you have these hormones that when they're going through puberty that are sending their brains off in different directions, right? So our sense of smell is so unbelievably poor compared to theirs. But their sense of smell is so much more developed, and they are smelling other dogs and the smells of testosterone and estrogen on the wind and the pheromones that they are picking up.
Mhm.
They have got they're essentially responding to so much more color in the world than we are. I'll use color because it's the way that's supposed to
Yeah.
describe it.
Yeah.
And so I think we're so blind to that because we don't really understand it or see it or smell it in this case. Um, so there's that as well. And then there's some sort of talk about like hormones being protective in a form in a behavioral way. So testosterone gives confidence. A lot of the time, I'm not recommending desexing until we are on an even keel these days, right? So if I've got
Yes.
maybe a case that's 6 months old and they're going, should we desex this dog? I'm like, hold on, just let's just see where we get to first. Like, there's not actually a rush for us to do it. I mean, yes, there's still cons of not desexing until they're older, but there's also a lot of pros of waiting and seeing how they develop with it on board.
Yeah. Yeah.
So I don't know whether that really answers our questions, and I don't think
Yeah.
it can at the moment. And I think it's going to be a really interesting place of development over the next few
Yeah.
20
Yeah, there's
years.
so much research and, like, the new research as well. I love Karen Becker and the new book that they wrote and the research that they've shared, and I just go down a rabbit hole, but I definitely notice just knowing dogs from puppy to, when they're 6 months old, and you're like clients are like, "Oh my god. Is this like my life now?" And the dog's like slightly more reactive to things, or, they get picked on, and so uh, I guess another question I have is when a dog is in that bursting hormonal stage, do the other dogs smell it and then pick on them potentially?
It definitely changes social dynamics, right?
Mhm.
And
Mhm.
it gives some of them an advantage, in fact, right? Some of them will use it. They know how to
Yeah.
alliance form using
Yeah,
and
yeah.
stuff. So I think there's a lot of competing motivations that we just don't understand at that stage,
Mhm.
right? So like I say,
We
we
just
don't
wanna be
know.
able to ask them what's going on.
Yeah. And also they're
Yeah.
going through what we call those fear periods during those periods of
Mm.
time as
Mm.
well, right? So if we have a traumatic experience during that time, it means a lot more to them.
Mhm.
So adolescence is a tough
Yeah.
time.
Yeah. Yeah. It's a time to be more careful, I suppose, is what I always recommend, just making sure you keep a really keen eye on what's happening, around them at that stage.
And I think a
So
lot of times that people miss like social cues from dogs as well,
yeah,
right?
yeah,
So I don't know about you, but I see a lot of times that they think dogs are still playing and they're not playing. The play
yeah,
is going to be mutual, right? It's got to be
yeah,
back and forth, and there's going to be breaks and space, and there's got to be some self-inhibitive behavior, right? Where the dog goes
yes,
down and the
yeah,
other one jumps on top, and then they swap. But
yes,
a lot of the time, I think those things are missed, and play is a really important thing for adolescents.
mhm,
But I think either they're not allowed to have normal play, or they are allowed to have play that is not
not normal.
okay.
Yeah,
Not okay for the other
yeah,
partner. Yeah.
yeah, yeah, absolutely. It's a very interesting time, and I also am excited to see what more research comes out and, yeah, maybe eventually find out what actually is the right call in terms of desexing and all of
I think
that noise.
I think we have oftentimes we need to consider a study of the individual.
Mhm. Yeah. Yeah.
And I think sometimes what we call this reactive behavior, this barking and lunging at the dogs, we see that
Mm.
almost a lot of people see that as confidence, right? They're just, they're going at it and they're doing it out of, and you're like,
Yeah.
but actually that dog's a
Mm.
scared dog, right?
Yeah.
And he could do with keeping his testosterone a little bit longer. So
Mm.
actually he has some confidence, but they're like, oh, but
Yeah.
he has plenty of confidence because he's shouting. And I'm like, yeah, but that doesn't actually mean that
Yeah.
you know,
Yeah.
he's actually doing that because he's not confident. Yeah.
Yeah. And then there's, you know, like for me, I rescued my dog and it's a requirement to get them desexed really early. And sometimes do worry about the effects that that could have. So I sometimes turn my head at the research like, oh, I don't want to know because like he was desexed so early, at 6 months. But I still feel that he potentially has some of that testosterone coming through. I mean, I really don't even I don't know. Can they still have it?
No, I mean he's not got the ability
Yeah.
to, but he's still an adolescent dog, and that his
Yeah.
brain is, and he's still detecting those pheromones. So
Mhm.
it doesn't completely get rid of the sexual
Yeah.
desire or interest,
Yeah.
right? We still have neutered animals who will still even have sex. But
Yeah.
so it doesn't completely remove all of the desire, but it
Mm.
definitely sort of dulls down the noise.
Yeah. Yeah. Okay. Interesting. I could go on with this forever, but let's move on. With chronic stress, this I mean, that's an interesting term in itself, and I know it can mean plenty of different things, but with a dog who's, reactive and in that stress state a lot, how does that linger in the body physically?
So there's a lot of physiological changes that happen with stress, right? So you have acute stress and then you have chronic stress. And the problem with chronic stress is that we don't get the feedback to that you're no longer in your fight fawning response, right? So you
Mm.
don't have that downtime, or the body says it's still in a reacting mode all the time. So there's a lot of things that having those hormones high all the time do elsewhere. So there's immunosuppression that can occur. There is things like, you're more susceptible to bacterial and viral infections, and cancer can actually be worsened by chronic stress. He's
Mhm.
got GI changes, so gastrointestinal changes. Sorry. So things like in humans, we are more susceptible to getting things like gastric ulcers because the gastric acid is increased and you decrease blood flow to your gut, which is what happens in your rest and digest stage.
Mhm.
You're actually, and same in dogs, is that they're more likely to develop gastric ulceration, right?
Mhm.
And then in dogs, what I see a lot of is abnormal behaviors and coping strategies. So those can be self-directed, like licking themselves, flank sucking and tail biting. So those are self-directed coping strategies. And you have environmental ones like eating poop and eating non-food items and licking
Mhm.
environment or overeating or um, over drinking, in fact, is one of the coping strategies. And then these can become what we call compulsive disorders, right? So they are compelled to do them.
Mhm.
We can't say that they're obsessive because we can't ask them, hey, did you think about this all day? Right?
Yeah.
We call them compulsive disorders because they feel compelled to do them. And those are major. Those are a big welfare issue. And so chronic stress sort of snowballs into all these other things that affects their physical health and their mental health and then we get aggression and we can get depression and we can get all of this sort of
Yeah.
all of these things that really can affect their welfare.
Yeah. Yeah. And with the like stress, this can come from anything, right? It could
Whatever the
come
animal
from
finds stressful.
yeah, yeah, yeah. And some animals are stressed, and chronic stress you would define as an animal that is stressed a lot all the time,
Long
most of the
term.
time. Yeah, long term. Yeah. And you did mention the gut. How strong is the gut-brain link in dogs, and how can those issues show up in
So we haven't
behavior?
got enough research yet, but that's coming too. There's a lot of
Mhm.
like discussion about the gut biome and which is the bacteria in the gut and
Mhm.
how those are changed and affected by stress as well. So there's that. There's also I would say practically in my practice I see a lot of gut pattern issues, right?
Mhm.
So a lot of the time there'll be underlying chronic grumbling gut issues that clients have not picked up. They're just like, oh, he's always got sloppy poop. And yeah, it's because he's stressed. I'm like, yeah, but chicken and egg, right? It could be
Yeah.
that that is actually something that we can address medically and
Yeah.
help them. And then that amazes me how much that will affect, again, like how much pain is involved in that, right?
Yeah.
How much of
Yeah.
this grumbling along there. So I think there's a lot of stuff coming out now about probiotics and prebiotics and um, different diets and how they affect. And again, I think we're like the tip of the iceberg here.
Yeah. Yeah.
There's gonna be a lot that comes out in the next 20 years. I know over our working lifetime that will tell us a little bit more, but then we're still going to have to come back to the study of the individual.
Yeah. Yeah. Absolutely. And I definitely notice talking about, the gut and the brain that when a dog is stressed, oftentimes, like for example, if there's fireworks one night, the next day my dog will have runny poos. And it's sort of even like a dog who's, overstimulated, they might have a solid poo and then they'll do a runny poo. And it just like is a very to
Fine
me,
line.
what just from my observation, it just seems like they're definitely connected, so I'm excited for learning more about that as well. Yeah. Yeah, it's crazy. Because
Let's talk
it's
about
obviously it's become huge for humans, and they have a gut and a brain, so, they have the
and
same system.
I think actually that leads me to an interesting point about stress, right? So there's distress and then there's eustress. So eustress is positive stress,
Mm,
like thinking of it emotional positive, as in a dog that's essentially had a great day out at daycare and has a wonderful time at daycare. And they're actually then afterwards They struggle to settle, or they struggle to have
Yes. Yeah.
stuffy poop the next day.
Yeah.
If we're thinking about filling our dog's cup, it's not always distress that we're talking about affecting their body.
Yeah. Yeah,
Eustress,
absolutely.
good stress can
Yeah.
do that too.
Yeah. Yeah, I feel like I get that. Again, we know you prescribe medication sometimes. Going back to that, how do you determine when medication is the right route or choice made?
If we're getting to that point of those abnormal coping strategies that I mentioned earlier, those are the times I'm often considering them. Um, so hopefully before we get into the compulsive sort of things, but if we've got a compulsive case, then I'm definitely looking at medications.
Mhm.
But it may also be that I'm looking at pain relief first,
Mhm.
because a lot of those, if we're thinking of stress, pain is a stressor, right? So as an internal stressor, we've got to kind of, sometimes I'm looking to pick which of these, if I'm going to start an animal on medication and I've got a client that really can't do more than one at a time, we might start with pain relief over an anxiolytic. But it also, like, I look at their daily stress, right? So, like, I might first be saying, hey, your dog really, really hates walks. We really don't want to keep exposing them to that stressor, right? So that
Mhm.
might be the first stage, is providing this animal with other forms of relief, enrichment, instead of
Yeah.
going out and barking
Yeah.
at dirty dogs on their walks, right?
Yeah.
So it depends on how settled they are in their comfort zone, right? So if we have
Mhm.
brought them back to a place of safety, but they're still, like, we have put them in a space where they're not being exposed to their stressor, but they're still detecting pieces of it, or in a place where they're in an environment that we can't do that with. I had one little dachshund that was, his owner was a hairdresser, and she would set him up upstairs in a room with background noise and curtains closed, but if 20 times a day clients were coming past that window to go to
Yeah.
her little, her room out the back where she did her work, and we couldn't prevent that in that environment, him feeling stressed.
Mhm. Yeah.
That was a case that medications was part of his protocol. I try, if I've got a separation case, right? So that might be a case where they all have to go to work and study. There isn't a possibility of, daycare's not suitable for this dog, house sitters are not suitable, let's get a stranger coming into the house. But a medication helps. Think of it, there's a couple of different ways we use it. One is a baseline medication, and that's most of what we're talking about here, where you're lifting their threshold, they're able to cope with a little bit more stress, so they're more settled, they're able to settle. And then you've got what we call event medications, which are specifically for the stressful event before it, to try and help them through that stressful period. So I might give a separation anxiety case an event medication as well.
Yeah. 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 Planning for planning for when you're gonna be gone for a certain amount of time or fireworks, for example. Yeah. Yeah. Yeah, that makes total sense, and also just sort of helping the situation, like the hairdresser who couldn't n there was nowhere else to put her dog, tried everything, and yeah, just adjusting the dog to the situation, I suppose.
Really not my, I really, really try my very hardest to make it suit them before we
Yeah,
reach for it in those cases. Um,
yeah,
but sometimes it can just help them enough that then we can start building positive
yeah,
associations with people coming instead.
yeah, and then would you wean them off eventually if possible? Yeah,
Possible.
yeah,
Some
yeah,
cases will be on it for life because we start weaning them off and we go, no, you really needed that. That support was really helpful.
yeah,
Other times we'll use it for 6 to 12 months while we're working on the behavior modification plan, and then they're away, they don't need it anymore.
yeah. And in those situations, how can owners tell if the medication or trainers tell if the medication is starting to help? Like, will they I know you mentioned earlier, like, a dog that's like blah, potato, that's obviously not working for them. Do you
Zombie
notice more
dogs.
engagement, things like that?
Yeah, so I would be looking for a more relaxed and settled dog during the day. I'd like them to be sleeping a normal amount, which by the way is 16 to 18 hours a day. We don't
Yeah.
realize dogs need a lot of sleep.
Yes.
And then I want them to be responding to their stresses at a lower intensity, and their brain is still a little bit engaged with you, right? So they might be, you might be able to access play more. You might be able to, are you interested in eating better? Like they might be, they should just be feeling a little bit more comfortable and a little bit more dog-like. I mean, I know that sounds strange, but a little bit normal dog, like a little bit more enjoying life a bit, because actually this is a quality of life thing that we consider. If we're considering medicating them, then
Yeah. Yeah.
quality of life affected here.
Yeah. Yeah. And bouncing off of that, how would you describe what a regulated dog looks like physically, mentally, emotionally? I know they're all different, but in general, if you have some words for that.
I think a dog that isn't able to sleep and able to rest, but still responsive to things in the environment. So like at a normal sort of, and I know that's hard. What is a normal little amount of
Yeah.
response to a trigger, a stimuli? I think, and it also depends on learning history as well. So a dog that has
Yeah.
never been taught a recall, you would expect them to recall all the way from a dog. There's that too. I think there's a lot to consider, and also breed specifics, right? So I don't expect a border terrier to be able to be relaxed when there's a hedgehog in the garden, right? There's just
Yeah.
no
Yeah.
way. But another breed that's not quite so terrier-like, there's probably going to be not so much of a problem for them to do or to come
Mhm.
away from.
Yeah.
So
I
again,
think a
go back to the
universal
individual.
dog, like, when the mailman comes, most dogs will bark.
Course. Course. I say to people as well, we're territorial animals as well, right? I've got 2 hectares in front of my house, and like if somebody comes down my driveway, I'm like, "Ooh, who is that? Like, what are they doing arriving at my house?"
Yeah.
But I've got more information provided to me, right?
Yeah.
I've got more information. I can tell that it's the courier because it's his van, and and my dogs sort of tend to develop that as over time as well. So like I've taught them that the courier is the guy that he comes regularly and he
Bring
lives
stuff.
again,
Yeah.
and sometimes dogs will learn that they bark at the courier and he leaves again. Funnily enough,
Yeah.
but
Yeah. Yeah.
it's I think what is it's a bit like asking people like what is a normal neurotypical person,
Yeah.
right? Like
Yeah.
what is an
Yeah.
like what how do we determine that? There's so many factors involved.
Yeah. 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 And just knowing, like, the breed and what dogs do and, going back to the expectations of a human or wolf. Um, yeah.
That does make me think. We haven't talked a lot about young dogs and hyperarousal behaviors, because I do see
Mhm.
a lot of times we've been talking about pain, but like how do we see that in a young dog compared to an older dog? I mean, an older dog might sleep more, might be more reluctant to jump, might not be quite so interested in its normal activities.
Mhm.
Bo's 14. He used to play, or he'd keep playing with a tug for like 20 minutes. Now it's enough for 1 or 2 tugs, then it's like, no, I'm done now. That's everything, right? He's arthritic and he's 14, and there's reasons for that. And we have to
Yeah.
be really careful that play doesn't hurt him. But a young dog, actually, we get the opposite oftentimes. We get dogs that are really, really intense prey drive or play drive. They're really sort of like they could glaze over and they completely shut out
Yeah.
the
Yeah. They're
stimuli.
not in, yeah, no one's home at their house.
And I see that a lot with dogs that have got pain underlying. Yeah. We
Okay,
get
yeah,
a lot of
interesting.
young dogs with hip dysplasia and elbow things. I've got dogs on the books that are only 6 months old and have done serious bites and serious. They can't take them out in public because they lose everything when they see a person walk past the car, right?
Mm.
one of the reasons is that they actually have underlying painful conditions, and that's increasing the intensity of that behavior so far past what they can cope with. And play as well. Play and prey driver are common things. And if you think of them a little bit like self-medicating as well.
Mm-hmm.
And how many
Yeah.
dogs will still play with the ball and keep going and keep going and keep going. And then later that night, they're actually acutely like limping. But people go, oh, well, why don't they stop? And well, actually, they're kind of getting some dopamine out of this. Like it makes them feel so much better to do it. And that's why they don't stop. There
Yeah.
has to be
Yes.
consequences.
Yeah. Yeah. They need help stopping and sleeping in some cases, right? And I love that, you mentioned sleep, because people with puppies are always, some people just think that, they need to go, 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 go to socialize them as much as they can in their little lives. But,
Both are doing
sleep is so important at that age, and you get that overtired, overstimulated, over playful, over with no sleep. And on that, what would you say about daily habits that support nervous system health for dogs?
I think sleep hygiene is our biggest thing from what we've literally just said, like puppies especially and adolescents. Older dogs tend to be able to regulate themselves, but we want them to regulate themselves, and if they
Mhm.
can't regulate themselves,
Mhm.
that's a red flag, right? So being able to go, we might go do some walk, but then you should be coming back and settling and sleeping, right? So we should be able to, if we have to, we might have to set that up for them.
Mhm.
And in some cases, and some dogs may struggle to settle away from humans, right? So we need to keep that
Mhm.
as a factor in that. So I know that we need you to sleep, and you may need to be attached to me to do that, because they actually need that reassurance and that level of attachment.
Yeah.
I think that's one of the things I find a lot of people go, why are they so needy, and they actually need us to help regulate them.
Yeah. Yeah. And then in other cases, dogs need their own space as well, away from everyone, where no one can go, under the bed or under the
Absolutely.
deck,
Where the kids can't
away,
go.
way far away. Yeah.
And in that's safety and predictability, right? So they need
Yeah.
to have spaces that they can go to that they feel safe. They need to understand that things are predictable, but they also need some stimulation that suits them best, right? So finding enrichment that suits that individual as well, and their breeding and the
Yeah.
rest of that.
Yeah.
I get a lot of cases where they're practicing these behaviors in places like the back of the car or the front bedroom, where they're like reacting to barking at people walking past or
Mhm.
dogs walking past, and people don't relate that to the behavior of barking at dogs on leash, right? So sometimes it will be management things like visual blocking.
Mhm.
That will be one of the
Yeah.
things that I'd suggest
Yeah.
some of these
Yeah.
cases.
Yeah. Yeah. It's not always something that can be, it's a normal behavior that sometimes it's going to happen, so we just have to manage those.
And it's a normal behavior that can become pathological if it's happening.
Yeah, all the time, and could turn into things like chronic stress. How do you think that trainers and behavioral vets can work together more effectively to support complex cases, or if a trainer thinks that their client needs to see someone who knows, a vet that knows behavior well? Yeah.
I like to see myself a little bit as the bridge, right? They're with between vets and behavioral trainers, right? But also I like to be I don't want to do I don't want to teach your dog to a session to follow me and on leash and those sort of
Mhm.
basic behaviors. Like I don't do that. Oh, I can do that, but it's like I need all of us to collaborate for a case. So oftentimes I'll have either the vet or the trainer refer to me, produce this plan, and then I send it back. And then the trainer, who is much less expensive to me as well, sometimes, let's be honest, can then
Mhm.
help support this client, and they can help with the behavior modification plan. They can feed back to me, hey, that management process doesn't work in this house. Okay, so there's that eyes on the ground. I've had trainers
Yeah.
videos going, do you think there's something going on with this dog's gait? The best cases are the ones that we have multiple people involved with. So there was a case in the South Island where the veterinarian who referred to me, and then I got a rehab vet involved and a local trainer, and then these clients are all in the middle, like might be orchestrating a little bit like that sort of might often miss
Mhm.
the point. But I've got the trainer on hand who's there helping them on their walks, and they're able to feed back to me that's the things they've seen on the walk and how this dog reacted, and being able to give that feedback that I might not see unless I go in person to a case, which I only do in the lower North Island. Everybody else goes
Yeah.
to my house.
Yeah.
Kind of like to see myself in the middle of the
The circle. It's good. It's good that we have 10, there's 10?
There's about
10 of
10 of
you
us who've
guys?
done the
Yeah,
exam. Not
yeah,
everybody's doing it. I might be the only one doing it full time.
mhm,
There is an Auckland Kiwi Vet Behaviour who are doing it as well, but I don't know how many of them are doing full time. And then there's, um, a couple in my area. There's like we all collaborate as well
yeah,
because
yeah,
let's be honest, what works for one client might not work with another one. So if it
yeah,
doesn't work,
yeah,
I've had veterinary behaviorists who've gone, this client's not working for me. Will they work for you? And like being able to collaborate in that
yeah,
way too.
yeah, yeah, absolutely. Having the bridge, yeah, between, like, because as you say, vets don't always know behavior, and having that bridge in the middle with someone who knows the medical side is so crucial.
Because I'm still like, sometimes I'll have trainers who go, hey, I think this dog is sore somewhere. What do you think? And then we'll go back to the vet, and the vet will still go, no, 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 no. And I'm like, yes, 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 yes.
Yeah,
I still have that, and we still have, but like I'm feel like being there and being able to educate the vets in that case, and go back and like validating the trainer, or vice versa. Like the trainer's saying, "Oh, this dog's just being naughty," and the vet's going, "I'm not this ain't medical." Like there's
yeah,
like
yeah,
so I'm like living this sort of like Venn diagram where I'm right in the middle of the medical behavioral, and most of my cases it's not as straightforward as this is a medical problem or this is a behavioral
mhm,
problem.
mhm. It's like a big mix of every of both.
And I think trainers sometimes I'm a little bit worried that they're going to send a case to me and they're not going to see it again. I'm like, no, 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 no. I will come and do this sort of like overview collaboration, sort of holistic look at it, and then I'm going to send it back to you, and it's going to like strengthen the bond between you and the owner as well. So
Yeah,
yeah, don't be
yeah,
afraid to get a veterinary behaviorist to have a look
yeah,
over the case, because we are there for all of the collaborations that are needed
yeah.
for this animal. Yeah.
Love that. Yeah. What's one message that you'd love every listener to walk away with, regardless of their dog's breed, age, or behavioral struggles?
I think that what did we say? The case of each animal is an individual. So this is
Yes.
case study of
Yeah.
one.
Yeah.
You're the expert in your dog's,
World.
day-to-day
Yeah.
world,
Yeah.
and also love them for their differences, for their
Yeah.
motivations, works, and their breed wants and needs, and just, you know, we we're all individuals and so are they, and just love how individual they are and what that means for your bond with them.
Yeah. Yeah. Absolutely. Thank you so much for being on. That was so fun. And so I've learned so much. And yeah, I am excited to be able to put people on to you if I think necessary as well. With that being said, I will link all of your website, your Facebook, and your Instagram below. But is there a form or something that people fill out to work with you, or just send you a message?
So on my website, there is a contact form for either vets who refer cases or clients and trainers to refer cases to. So I've got my wonderful admin person, Claire, who keeps me sane. And she triages and contacts and goes back and forth to you, your vet, getting everything together for our case so that we can do what we need to do for your animal.
Awesome.
Yeah, you can also reach out through social media. I'm likely to send you through to Claire because that's the best way. So she's the best person to talk to. She keeps me sane. And
Thanks,
yeah,
Claire. Shout out to
thank
Claire.
you, Claire. And yeah, I'm hoping to expand as well. So we'll see. Hopefully, get more vets interested in doing this and being doing behavior as
I think
as
it's
a
really important.
medical niche. I
Yeah.
think that people don't realize that it's actually I'm still a vet. I'm a medical professional. Like I see referral cases instead, but like a cardiologist, but for behavior. And
Yeah.
that's what I do.
Yeah.
If you like this episode, please share it with a friend. We'd love to hear your feedback. For more advice about training or nutrition, you can always contact us on any social media sites. We are at Zumi's Dog Training Adventures and at Zumi's Dog Nutrition. You can also book in a virtual training or nutrition consultation at zumisdogtrainingadventures.com.